Okay, it is 2 o'clock. So again, my name is Katie Waters. I'm with Iowa Homeland Security and Emergency Management. I am the state's public assistance officer. So this call today is to discuss the new policy that FEMA just released. It's an interim policy, and it supersedes the previous fact sheet that was out there that discussed eligible emergency protective measures for disasters related to the COVID-19 pandemic. The specific disaster declaration for Iowa is called Disaster 4483. So this policy takes effect on September 15th of 2020. The policy will apply to work performed on or after September 15th, 2020. So any work or projects that capture work that was performed prior to this date will actually still fall under the previous fact sheet that discussed eligible emergency protective measures. So what this means is for projects that are unobligated or unwritten in relation to COVID-19 in Iowa, as of September 15th, any costs that relating to work to be performed after that September 15th date will fall under the new policy. And we'll go through the changes in the policy in a little bit. So what this means would be for projects that were awarded prior to the September 15th date that include projected costs for work to be completed after the September 15th date. The projects will be handled in a couple different ways. If it's a small project, which are projects that fall under that 131,100 threshold, those projects will not be adjusted. And the reason for that is it ties back to, there's actually a section within the Stafford Act that prevents FEMA from coming back and reversing eligibility determinations. But this portion in law only relates to eligibility determinations that have been essentially obligated and paid out. So with large projects, those that have been obligated, that have costs for work that fall after that September 15th date, when we get to close out of that project, if we have not paid out or drawn down on the funds for work falling after that September 15th date, we will have to modify the eligible scope of work based off of the new policy. I'm sure everybody has questions on this. If we can hold the questions to the end, we'll try to address everything before we sign out today. So the major changes, the policy further defines what eligible emergency protective measures are in response to COVID-19. The policy also restricts the eligibility of the emergency protective measures to those that are defined within the policy. So our eligible applicants under FEMA public assistance remain the same. However, you'll find when we get into the eligible work activities that the work activities themselves are restricted primarily to state, local, territorial, and tribal governments in performing emergency protective measures. And there are certain private nonprofit entities that will continue to be eligible under the work activities if they own or operate a facility that performs eligible work as defined in the work activities that we'll discuss later. This next piece, the is not new, the last bullet on this page, I'm just bringing this to everybody's attention. So most of you who've encountered this already, this is not a change. So Under this event, FEMA is clearly defining the legal responsibility for the performance of emergency protective measures. And they've determined that it is, in most instances, going to be a state, local, or tribal government that has a legal responsibility to perform emergency protective measures. So this would be like for medical care, distribution, or the provision of food, or sheltering activities. Private nonprofits would not be eligible to apply for these items directly through FEMA. Those types of activities would be the legal responsibility of the state or local government to be providing that assistance, and therefore those entities would have to enter into agreements with the private nonprofit entities in order to seek the reimbursement through FEMA. So emergency protective measures are defined as activities conducted before, during, and after an incident. The incident period for the COVID-19 disaster 4483 event is still open. And these are activities that are taken to eliminate or lessen immediate threats to lives, public health, or safety. So this first slide that covers the eligible work under the new policy, these are the same activities that you would find under the fact sheet. Really no change here, and the implementation would be the same as we were doing under the fact sheet. So again, the purchase and distribution of food, medical sheltering, otherwise known as our NCS activities, and the operation of emergency operations centers, communication to disseminate public information regarding health and safety. Again, it's going to tie back to who has the legal authority to be conducting these activities. And FEMA's determined that it's going to be the state, local, and tribal governments that have the authority to perform this work, okay? So this next slide, this is where the major changes begin. So under the old fact sheet, the purchase and distribution of PPE was eligible, and it is still eligible. However, they've further refined who it's eligible for. So this new language here that they've added is the PPE to be eligible has to be directly related to the performance of eligible emergency work, or provided to healthcare workers, patients with confirmed or suspected COVID-19 infections, and first responders. So previously, the policy wasn't as restrictive. So I'll give an example. If the state or local, like the county emergency management organizations were purchasing PPE and distributing, say to city halls, PPE or disinfectant supplies, those items will no longer be eligible to be distributed to city halls under this new policy. Those items would need to be provided to entities that are directly responding to COVID-19, which are going to be your healthcare workers and your first responders. Same goes for the temperature scanning equipment. Again, those are going to be only eligible for distribution to facilities that are actually performing the emergency work, response work. And then something else that we found to be quite common is the installation of physical barriers to provide for the social distancing mitigation measures. We saw a lot of this under the fact sheet where FEMA was determining it eligible previously, like in courthouses, city halls, other public facilities. Now the installation of these items will only be eligible in facilities that are actually performing the emergency work and directly responding to the public health threat. The policy further defines what personal protective equipment is. I won't read it verbatim, And they also provide a definition as to how they define a first responder. So first responder refers to emergency public safety, fire, law enforcement, emergency response staff, emergency medical staff, and then any staff that are located in those facilities that may interact with individuals that have either been infected or suspected to have been infected with COVID-19. So I know this was just a real quick and dirty review. I just wanted to make sure we reviewed the major changes. You can access all of the COVID-19 guidance at this location on FEMA's website. So the only document that's superseded by this policy is the fact sheet. There are a couple other policies that FEMA released that are specific to like medical care, non-congregate sheltering, purchase and distribution of food. Those policies are still in place, and this new policy is meant to support those policies. So it is simply the fact sheet that has been superseded. So you can, I will open it up for question and answer right now, but following the call, if you stumble across additional questions that you might have, or your staff are encountering as they submit projects under the FEMA Public Assistance Program, please feel free to email recovery school correspondence@iowa.gov. That is a group email. So there are a couple of the state public assistance staff that are on that email address, and we'll be able to hopefully answer questions quicker than if it were to come in, if questions were to just come in to me or to Rick Biondi, because we'll have a couple different people that have access to this email address, and we'll be responding at the same time. Okay, so we had a question that came in. The question was, hospitals are still eligible, correct? Yes, so the caveat to the private nonprofit entity having to apply or enter into agreements with state and locals in order to be eligible for reimbursement through the state or local government. That does not apply to hospitals or medical care facilities. Typically, those providing that service is more of an emergent issue. And so the hospitals are still eligible to apply directly to FEMA public assistance for reimbursement. Okay. So another question here, how about institutions of higher education? Can our health services personnel be eligible for PPE, overtime, etc.? Unless the institution of higher education is a state agency, they typically, the way FEMA's answering this question is that it would be considered an increased operating expense in order to provide the service that the school always provides, that the PPE and overtime would not be a direct response activity for COVID-19, so it would not be eligible. Okay, another question here is the hiring of temps to perform contract tracing on behalf of public health departments eligible? Purchase, rental of equipment. Okay, so in regards to the hiring of temps to perform contract tracing on behalf of public health departments, if this is a county government or a city government that's hiring temp employees to do the contact tracing, yes, that would be eligible. Purchase, rental of equipment, again, that's going to be the type of entity who's asking the question. If it's a state, local, or tribal government that is directly responding to the event, the purchase and rental of equipment would be eligible. Okay. So the next question is regarding K-12 schools. Are schools still eligible? So this is going to go back to the question, same answer that was given about the higher education. The purchase of PPE or equipment or disinfectant for schools, FEMA is saying this is again a increased operating expense resulting from the reopening of schools and is not a direct response emergency protective activity, so would not be eligible moving forward. The next question is, can you clarify if we incur the cost before September 15th, but submit the project after September 15th, what that means? Yep, if the cost or the work was performed prior to September 15th, it falls under the fact sheet. It does not fall under the new policy. So even though we're writing the project after the 15th, we will follow the fact sheet in regards to what's eligible. So the question in regards to how, it says, how about testing students and staff? Again, I think that falls to who is testing the students and staff. If it's a county public health that's performing the testing, then yes, it would be eligible. If it is the institution of higher education, no, because it is not the institution of higher education's legal responsibility to do so. Next question is, if I haven't submitted a project yet and my total PPE expenses are less than $100,000, does this new guidance apply, or do I need to submit by September 15th to be eligible? Again, if the PPE was purchased and used before September 15th, then it falls under the fact sheet and does not fall under this new policy. Okay, the question from Potawatomi EOC, mitigation equipment, disinfecting contracts, etc. at courthouses or city halls are no longer PA eligible on or after September 15th. Correct. Prior to September 15th, those items would fall under the previous fact sheet and would be considered eligible. After September 15th, they would no longer be considered eligible. Are there any changes to non-congregate care that is requested through the county but subcontracted to a local non-profit? No, as of right now, there are no changes to the non-congregate sheltering guidance. There are discussions about things changing, but as of right now, we haven't seen any changes. So the next question is the 130,000 breaking point for the total project or on the FEMA share? That would be for the total project cost. If it falls up over that 130, I think it's 131,000, it's considered a large project, and that's the total cost the project's written for. Next question. Our county hired a temp to act as a temperature screener to take temperatures prior to people entering the building. Is this still an eligible expense? It depends on the facility. If it's a facility that houses staff that are performing emergency protective measures, then that activity is still eligible. If it's, say, at a county courthouse or a city hall and the staff is not performing emergency protective measures in response to COVID-19, then no, it would no longer be eligible after the September 15th date. How is direct response to event defined? A direct response to the event. This is a very good question, actually. This is something that we've struggled with a lot with FEMA and getting them to define. I suppose the best way they've defined it would be if If the activity is directly related to protecting public health and safety, and not related to the reopening of the states and government, then it would be defined as an emergency protective measure, eligible under the FEMA Public Assistance Program. Are emergency management agencies still directly eligible, or do they need to submit through the county? Emergency management agencies are still directly eligible. They are considered a local government. If a protective window was installed at a city hall prior to September 15th, 2020, is that covered under the previous FEMA guidelines? Yes, it would be covered under the previous fact sheet. Okay, hearing two different things with some of the question answers. They've asked about rental equipment, other items, and for the SLTTs, but what if it's not a location where they are considered doing emergency work? Okay, so the purchase of equipment and supplies to be eligible under the new policy, it's going to be for entities, applicants, state and local, tribal, or territorial applicants that are performing emergency protective measures. Those purchases are not eligible to protect the public utilizing public facilities. Does that better clarify that one? Okay. Next question is, we are a public school that ordered PPE before September 15th and submitted a FEMA grant, but have not yet received some of the items. What fact sheet do they fall under? This happens to be one of the questions that we still are pending an answer. My guidance at this point in time is if it was purchased and you have invoices prior to September 15th, we're going to utilize or default to the fact sheet that was in place prior to September 15th, even if those items hadn't been received yet. That is subject to change pending further FEMA guidance. Okay, another question. Would overtime hours performed by staff responding to COVID workplace issues be eligible? Again, the overtime hours have to be directly related to emergency protective measures being performed by eligible applicants. So if it's overtime in relation to sanitizing city halls to protect the public, that would not be eligible. If it is sanitizing a medical care facility, because that medical care facility is directly responding to COVID-19, it would be eligible. We are currently leasing a warehouse to store PPE. Will FEMA continue to fund this after September 15th? Yes, so the cost for storage of PPE is eligible. The policy does define this a little bit further. They're allowing the purchase of PPE for 60-day operational periods under the new policy, and the warehouse storage would be for the storage of up to a 60-day supply. What if you're still waiting for approval of a FEMA grant? Can you still follow the fact sheet for PPE, disinfectant, and plexiglass? Again, it depends on the date that those items were purchased or the work was performed. If it was prior to September 15th, regardless of whether or not you've received FEMA approval, you'll fall under the previous fact sheet. If those items haven't been purchased, the work hasn't been performed as of September 15th, it will now fall under the policy. Sorry, I'm reading through the questions. A lot of them I just answered, so. Okay, so the question is are dollars you spend before September 15th paid 100% even if it is under the 131,000? what is the difference between a large project and a small project? Okay. So a large project is actually, it's paid on actual costs. So for large projects that are over that threshold, we will actually require all supporting documentation to determine the actual eligible cost, and that's what the project will be paid out on. It is a 75% federal share and a 25% non-federal share. At this time, the 15% local share, there is an opportunity for that 15% local share to be covered by CARES Act funding. The 10% state share will be paid out as normal, whether it be through CARES Act funding or through our normal process of seeking those funds through the Executive Council. The 10% will be paid. So the caveat with the 15% local share, that is, the CARES Act funding comes with a very defined timeline for the use of those funds. It's, I believe, between March and the end of December. The CARES Act funds can be utilized to meet the 15% match. So if you had costs that were incurred prior to March, we would not be able to utilize the CARES Act fund to meet the 15% of those costs. And then anything incurred after the December cutoff date would not be met with the CARES Act fund. So there is a potential that you'd still have a 15% local share. Okay, next question. If a nonprofit hospital is converting space in the clinic to a COVID clinic, are these expenses allowable? The clinic will be reverted back once the pandemic is over. Yes, there is another policy that actually covers this. And what I'd actually ask you to do is email me directly at katie.waters, W-A-T-E-R-S, at iowa.gov, just so I can get you the policy on that. Okay, the next question is, when it says temperature screening is included, does that include internal labor costs of manning those screening locations only when using overtime or when you use regular labor? The eligible temperature screening labor costs would be, typically it would just be overtime, but that's in relation to permanent staff time. If you've brought on staff or they're unbudgeted staff performing those functions, there is a potential that straight time labor would be eligible. Next question was, a temporary contracted staff greeter to meet the public, identify if the individual has an appointment, and admit the citizen to the common area elevator. We project the contracted temporary staff to continue through December 31st. Again, it's back to who is housed in the facility and whether or not the facility itself houses staff that are performing direct response emergency protective measures to COVID-19. Okay, next question. Just to operate the city hall, a courthouse, or a school, purchasing PPE, sneeze guards, and other mitigation equipment would not be eligible at the new deadline because the facility doesn't do emergency work, even though the intent of those items is to mitigate public spread. That is the correct interpretation. For institutions of higher education, what can the funds be spent on after 9/15/2020? Yep, I think you've landed on the real question here. I think what's happening is FEMA has realized their exposure and they're trying to, I'd say, they're trying to get out of the game of paying for operation expenses in order to continue governmental functions moving forward. So those types of items at, say, institutions of higher education, like purchasing the PPE or disinfectant, would not be eligible moving forward. And that's because they're drawing a line saying that those items are now required just to continue the services that that the schools are normally supposed to provide, and it's not a direct emergency protective measure in response to COVID-19. So the next question, for public schools, you mentioned the purchases prior to September 15th, even if products were not received prior to the September 15th date. What is the definition of purchase in this instance? For example, if a purchase order was created prior to September 15th, we don't technically purchase incur costs until products are received. Again, I think this is something that we're going to end up having to get some further clarification from FEMA on as to how they're going to define purchased or incurred. The guidance, I would say, if you have a document showing that the items were ordered or purchased prior to September 15th, then we are going to attempt to put it under the old fact sheet as opposed to under the new policy. When can we expect approvals of a grant? The projects are depending on the quality of the information that's provided at the time the application submitted. It can take anywhere between 10 days to 3 months. The 3 months are supposed to be the atypical situations. You would normally only see that lag time if the quality of the information originally provided is poor and FEMA's having to issue multiple requests for information in order to clarify the purpose of the grant. So I would typically say between 10 days to a month would be your average time to see the approval of a grant. Next question, are institutions of higher education allowed to use funding for laptops, hotspots, Zoom, room cameras, speakers, mics to connect people to campus virtually and allow social distancing? No, that would not be an eligible item under the policy. And we've actually experienced that that was not an eligible item under the fact sheet either. FEMA determined that those were not emergency protective measures, that was an increased operating expense. We will post the slides. Actually, the fully recorded presentation with the Q&A should be posted to our website, hopefully by early next week. The website address is Iowa Homeland Security. I think it's just iowahomelandsecurity.org. Does the $3,300 minimum on the prior fact sheet still apply? The city did not have $3,300 prior and had to withdraw the RPA. The $3,300 minimum is, that's actually included within regulation. There's a small project threshold that must be met, so that does not change with the policy. Can nonprofit churches apply for FEMA reimbursement for expenses due to COVID? The question specific to PPE live streaming equipment. My answer here is going to be the chances are FEMA would determine that the nonprofit church is not conducting public health and safety measures to protect public health and safety. So those would not be considered emergency protective measures that are eligible under this event. The question is, will Iowa Homeland Security and Emergency Management be appealing the short notice change in eligibility from FEMA? We are not submitting a formal appeal. We are utilizing the different outlets that we have in order to submit comments. Again, this is an interim policy, and typically policies go out for comment before being formally instituted. There was not a comment period for this policy, so we do expect to be given the opportunity to submit comment. Next question is point of clarification. If we submit a small project, when can we expect to see reimbursement? We understand it's typically reimbursed after a disaster is closed, but are there exceptions with COVID response? Okay, so I may have gotten a little sidetracked when we were talking about the difference between large and small projects. So I discussed that large projects are paid based off of actual costs. Small projects are actually paid upon obligation. So once FEMA awards a small project, as long as we have the pre-award risk assessment and the funding agreement completed by the applicant, we will issue payment. So we do not wait until closeout in order to make payments for small projects. That's the federal share. Regarding the state share, the 10% state share, the 10% state share is paid off of actual costs. So we do wait to make payment on the 10% state share for small projects and large projects until closeout. Okay. Yes, the website to obtain the slides and the recording of this presentation will be iowahomelandsecurity.org. And again, it won't be posted until next week. Rick, I know you're on. Is there anything you'd want to clarify? Okay. Well, we have made it through the questions that I have submitted here. Again, if you have questions that you didn't want or didn't have enough time to think through in order to submit on this presentation, you can go ahead and email the recovery correspondence at iowa.gov email address. Rick, is that you?
It is me.
Great.
I was the website is iowahomelandsecurity.iowa.gov.
Okay, is there anything else you'd like to discuss?
Nope, that's it. Thank you.
Okay, well, I'll hold on here for another 10 minutes for anybody that might have questions before we log off, but everybody else, oh, look, I've got a couple more questions. Anybody else that's ready to log off, you can log off unless you want to hear the additional question and answers. Okay, so the next question was, should the Emergency Management Agency apply to the LGRF for their 15%? So this question is in regards to the CARES Act funds that are made available for the non-federal match to the FEMA Public Assistance Program. You do not have to go through an application process for the non-federal share. That will be paid based off of the costs already submitted under your FEMA public assistance project. So there is no additional application required. So the question is, what if first responders are in the city hall? Those expenses should still apply, correct? What about city personnel that directly support first responders? If you can make the case that the first responders are located in City Hall and therefore the activities or the purchase of supplies and equipment for City Hall are related to mitigating COVID-19 amongst the first responders and to protect the public from any exposures within the first responders, then I think you have a case there. And that would be the same with the city personnel. Yep, so the next question is unrelated to COVID-19, but the question was, will you be offering a FEMA applicant briefing for damage incurred from the Midwest derecho? There were applicant briefings hosted for the original 16 counties that were declared. You can go to the Iowa Homeland Security and Emergency Management website to access the recordings of the applicant briefings. If you're located in a county within one of the 7 counties that were just designated yesterday, we will be hosting and sending out a schedule for applicant briefings next week. Next question, how long do we have to complete our claim under the 9/15/20 rules? There is no deadline as of right now to submit the costs for work completed prior to September 15th. Again, there is no end to the incident period, so it is still open. If we purchase PPE and have it in stock but have not used it yet, is it covered under the fact sheet or the new policy? How should we proceed with reimbursement? So this question actually came up with FEMA this week. They didn't know how to answer it. My recommendation is anything that was purchased prior to 9/15 or incurred prior to 9/15 or used prior to 9/15 should fall under the fact sheet as opposed to the policy. That is how I would recommend you proceed. However, it is subject to change based off of future FEMA guidance. The next question is, we submitted a grant in April. I followed up in July and was told the grant is still awaiting approval. Is there something else that I need to do to follow up on this? I believe you need to contact myself or Rick Biondi. My name is, again, it's Katie Waters. The email address is katie.waters@iowa.gov. Okay, so next, so Bob here, it says, I've already sent in and been paid the federal share for my projects. We understand we'll get the state share later after disaster close. Will the state also pay us the local share after close, or should we go ahead and claim the local share of these projects under the LGRF? The local share is a separate allocation under the CARES Act. It is not part of the LGRF. So the local share will be provided to our agency, Iowa Homeland Security and Emergency Management, and we will be issuing the payment. We are still working through some administrative details with the governor's office, and so we have not begun issuing the local share, but you can expect that to be coming within the coming months. Okay. I've run out of questions. Again, I'll hold on a couple more minutes just in case we get anything additional. So there is the cost share for the grant, the FEMA public assistance grants, is 75% and 25% non-federal. The non-federal share is typically broken up 10% state, 15% local. Under the COVID event, there's been CARES Act funding that's been made available to cover the 15% local share. So the 10% share, state share, will be paid regardless of whether or not it's through CARES Act funding or through the Executive Council funds. It is dictated within code that we provide the 10%. So the 15% that is the portion through CARES Act that we're going to attempt to pay as much as possible with the CARES Act funds to cover the local share, the 15% share. But again, it's limited to expenses between March and December 30th. So there's an opportunity in this event, if the incident period for FEMA public assistance stays open, that there will be costs incurred after the December event that we won't have, December date that we don't have CARES Act funding to cover the 15%, or if there are costs for an applicant that were incurred prior to March, those would also not be eligible to be covered with CARES Act funding. Will I unmute for Brian? No, I'll see if I can figure that out here in a second. So where do you apply for FEMA public assistance? You actually apply at Iowa's grants management system. The website is my.iowahomelandsecurity.org. Can you repeat the state percentage of coverage? So again, the cost share for FEMA public assistance is 75% federal, 25% non-federal. The 25% is typically broken up 15% local, 10% state. The 10% state will without a doubt be covered in this event. It's dictated by code that we cover it. It's the 15% that we are attempting. We actually have an allocation through the CARES Act funding to cover the 15%. So we are going to attempt to cover the entire 15% with the CARES Act funding if it falls within the timeframes allowed. Okay. The question in regards to the CARES Act, it says under the CARES Act, we've been awarded, let's just say 2,500, and under the information sheet, we have the RFR public health 72,000 and public safety 229. Total of, do I still submit that or get it down to? You know what, Beth? I don't think I understand your question. So please email me at katie.waters@iowa.gov. Not your fault. It's probably I'm just trying to read through it too quick. During COVID pandemic, does FEMA help the county cover costs for greater bandwidth and better phones in the courthouse? No. That would be considered an increased operating expense. Okay, now let me figure out how to unmute here. Rick, if you know how to do it, do it. I'm so sorry. Apparently Rick's checked out on me and he's just gonna let me flounder here. Okay, the next question was, because of derecho, we don't start school until September 21st. Are PPE expenses that we have already purchased and submitted eligible? So we've actually struggled with the purchase of PPE for schools, even under the old fact sheet. FEMA had determined under the fact sheet that it was an increased operating expense or an increased cost of providing a service as opposed to a direct response activity. So you can continue to try to submit it under FEMA public assistance if the costs were, if it was purchased prior to September 15th, and we can see what FEMA says. Regarding the 60-day PPE restriction, how would you recommend EMAs purchase or plan for fluctuations of requests based on product demand? How would I plan for you? How would I recommend you plan for the fluctuations? Really, I would not be able to answer that. I can only tell you that you should probably, if you can determine what your burn rate is, which I know you're familiar with doing so in order to request the resources for, through the state EOC. So if you just determine what your burn rate is based off of historical use, I would just do it that way. Unfortunately, you would not necessarily be able to project for an increase because it will be based off of your historical burn rate. I don't know if that answered your question, Jim, but. Okay, I'm gonna give it another 8 minutes before I sign off. I apologize, I have another meeting I have to jump on at 3. So the next question is, we have been set up in grants portal. Is there a worksheet we need to submit our expenses on? Yes, there is. It's called the streamlined application. If you should have already been contacted by a state person or a FEMA person known as your program delivery manager, if you've already been set up in the system. If you don't know who that person is, or for some reason you were not contacted, again, you can shoot me an email. It's katie.waters@iowa.gov. Okay, Brian, I apologize. I can't figure out how to take it off of mute. And I'm not sure if when the meeting was set up, if it gave the ability. If someone who's super smart wants to put it in the chat to help me out, that'd be great. So I can unmute specific callers, but I can't unmute all from what I can tell. So Brian, who'd you sign in under? Okay. Well, thank you, Michelle. It looks like Rick is the one that was set up as the host, so he's the only one that can unmute all. So the next question is, we installed glass partitions on the counters of the offices in the courthouse to protect the public and employees before we reopened in June. Would this be eligible? If you did it prior to September 15th, it would be eligible under the previous fact sheet. Okay, looks like we've got, most people are signing off now. I don't have any questions. I will again hold on. Where is the fact sheet? The fact sheet, let me see if I can go back to the page here. You can find the fact sheet at this address here. I did check earlier and the new policy was not yet uploaded to the FEMA website, but the policy was attached to the meeting invite that Rick sent out. So the question is in regards to looking at different things to improve the air quality of buildings, and looking at the statement below, will this be covered reimbursement from FEMA? So I will just say it's emergency protective measures that are eligible under this event. So normally permanent modifications to facilities would not be considered an emergency protective measure. So I have not seen much success in making the case for eligibility of modifications to like air handling units within buildings. So the next question was just to clarify, when you said that you will be trying to use state CARES Act dollars to make the 15% match for approved expenses between March 1st and December 31st, 2020. When will you know if that can happen? And would that apply to expenses by healthcare orgs even after September 15th? So I should have explained this. So yeah, the CARES Act funds currently are available to city and county governments. And are not currently available to private nonprofit organizations. There is discussion as to whether or not they will open it up to private nonprofit organizations, but that is still under consideration with the governor's office. Okay, state, local, tribal or territory government, non-emergency work facility contracted for sanitation prior to September 15th, but the contract for work goes through the new deadline. Is it eligible or cut off with the new policy? So with this, the work performed would actually dictate the dates of the work performed will actually dictate the eligibility of the cost either under the fact sheet or the policy. So if the sanitation activity is not happening until September 15th or after, it would fall under the new policy. Anything performed prior to September 15th would fall under the fact sheet. Where can we get a copy of the previous fact sheet? You should be able to find the fact sheets on the FEMA website where they've compiled all of the FEMA public assistance COVID-19 guidance. So if you can see my screen, here's the link to the FEMA website. All right, that does it for today. Again, if I didn't get to your question or if I couldn't unmute you, I apologize. You can email recoverycorrespondence@iowa.gov with any further questions, or you can contact me directly at kd.waters@iowa.gov. Thank you for joining me today.